What is noise-induced hearing loss? Noise-induced hearing loss is a sensory neural hearing loss that is caused by a sudden or continuous exposure to high-intensity sounds. It's the only type of hearing loss that can be prevented, yet the most common among U.S. adults. In fact, about 12% of Americans show signs of NIHL. When the auditory system is presented with acoustic trauma, the intense noise results in an overstimulation of the hair cells located in the inner ear. The overstimulation leads to cell injury or death that is impossible to reverse. Symptoms of noise-induced hearing loss include an inability to attenuate auditory signals, as well as ringing of the ears, ear discomfort, or increased ear sensitivity. Noise-induced hearing loss is unique because it's thought to either be temporary or permanent. However, recent findings suggest that noise-induced hearing loss isn't as temporary as originally suspected. Depending on the intensity of the sound and the amount of time the ears are exposed, noise-induced hearing loss, whether temporary or permanent, plays a role in the acceleration of age-related changes in hearing. Noise-induced hearing loss can affect any population of people who are exposed to intense sounds. War veterans often experience permanent noise-induced hearing loss due to a repeated exposure to sounds such as gunfire or explosions. Acoustic trauma or blast trauma is common. Construction workers also contract noise-induced hearing loss because of the heavy machinery used in this line of work. Tools such as jackhammers or power saws are extremely loud, damaging the hair cells in the inner ear. Other populations affected by NIHL are music or sports fans. Individuals who attend a lot of concerts or those who listen to music at high volumes are at an increased risk for hearing loss. Fans who attend loud sporting events like Gator football games are also at risk due to the increase in decibels in these environments.
Noise-induced hearing loss's main difference from other hearing losses is that it's caused by noise exposure. Differential diagnoses include autoimmune disease of the inner ear, genetic sensory neural hearing loss, otosclerosis, ototoxicity, presbycusis, and sudden hearing loss. During diagnosis, a clinician may ask a patient if they find themselves asking people to repeat themselves, turning up television volume, or have difficulty understanding speech in noisy environments. A physical examination of the ears is conducted, including assessing the presence of cerumen in the ear. These examinations are usually conducted in an audiologist's office. An audiometer is used that tests both air and bone conduction. Different frequencies will help determine the severity of the hearing loss. 24 million workers are exposed to severe levels of occupational noise, and around 11.4% are affected. It can hinder communication abilities and can increase risk of injury. Hearing loss can lead to anxiety, depression, and social isolation.
The results of a hearing test are recorded on an audiogram. Here is an example of an audiogram from someone who has noise-induced hearing loss. Usually, this type of hearing loss will first be seen as a notch around 4,000 Hz. Threshold shifts in the 3,000 to 6,000 Hz range indicate hearing loss in the higher frequency range for human voices. As exposure to loud noises continues without preventative measures, this notch will deepen and widen progressively into lower and lower frequency ranges. Noise-induced hearing loss on an audiogram typically has a hillside-like shape. The steeper the hillside, the more severe the hearing loss.
Noise-induced hearing loss is preventable. In fact, it is the only sensory neural hearing loss that can be prevented. You and I can protect ourselves by avoiding exposure to high-intensity sounds like concerts, sporting events, battlegrounds, and construction sites. Although concerts and sporting events are fun, it is important to be aware of your sound exposure and wear earplugs at these events. Noise-induced hearing loss can happen to anyone at any age, and that is why it's so important to work on prevention as early as possible. Noise-induced hearing loss can be noticed right away or can occur over years of loud sound exposure. Noise-induced hearing loss does not only occur when exposed to high-intensity sounds for long periods of time. It can also occur after a few short exposures. It is important to note that sounds under 75 decibels are not considered damaging. Sounds measured at above 85 decibels is where you should begin to think about prevention. To give a few examples of different decibel levels, conversation is approximately 60 to 75 decibels. A motorcycle is approximately 95 decibels, and gunfire is approximately 150 decibels. This should show you that we are exposed to potentially damaging sound levels on a daily basis. Noise-induced hearing loss can also be prevented by avoiding loud environments. That is why using earplugs is even more important at special events like concerts or football games. Noise-induced hearing loss is prevented by using protection such as noise-canceling headphones or foam or wax earplugs. Here I will demonstrate how to properly insert foam earplugs. With clean hands, roll the earplug between your thumb and pointer finger. With your free hand, reach over your head to pull the ear up and back. This will open up the ear canal. Insert the earplug and allow it to expand.